Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. Today we are going to see about syndromes and drugs. So when we are administering any drugs, there is a chance of developing a group of symptom that is known as syndrome. So before going into the topic, I'll ask you a question. So do you know what is mean by grey baby syndrome? If not, then do you know what is mean by red man syndrome? Okay, then do you know what is bronze baby syndrome? So if not, this video is for you. We'll see in detail about if you are administering any drugs, what is the different kinds of signs and symptoms that occur in the patients. That is known as syndromes, drugs and syndromes. So without wasting much time, let's get started into the video. If you find this video to be useful, like it, share it and subscribe it, and click on the bell icon to have a latest updates in this channel. So first is amiodarone. So when you are administering amiodarone, there is a chance of developing one of the syndrome. So do you know what that syndrome is? Yes, that syndrome is Blue Man syndrome. So Blue Man syndrome or amiodarone induced skin discoloration is a rare but benign side effect of chronic amiodarone therapy. So characterized by blue-gray discoloration of the skin, particularly in the sun exposed area. So what are the sun exposed areas are like faces, necks. So in that area they will be developing a syndrome of Blue Man syndrome if we are giving amiodarone. It is not that everyone who is receiving amiodarone will have this syndrome. In some cases there is a chance of developing this Blue Man syndrome. So next is aspirin. So aspirin we used to administer to the patients. When administering aspirin for long term, there is a chance of developing the Reye syndrome. So we'll see what is mean by Reye syndrome is. Reye syndrome is a rare but serious illness that causes swelling in the liver and brain, typically occurring in children and teenagers after a viral infection. So often linked to a aspirin use. So this aspirin use causes the Reye syndrome, that is mainly the swelling of the liver and brain, and that too in the age group of children and teenagers. So next is we are going to see chloramphenicol. So when we are administering the chloramphenicol to the babies, there is a chance of developing grey baby syndrome in the children's. So what is mean by grey baby syndrome? We'll see in detail. So grey baby syndrome is a rare and fatal condition that can affect the newborns and infants and up to 2 years of old. It is caused by an adverse reaction to the antibiotic chloramphenicol. So when we are administering chloramphenicol to the children, there is a chance of developing the group of signs and symptoms. That condition is known as grey baby syndrome. So now we'll see how the grey baby syndrome baby will look like. So this is how the baby will look like. That is greyish color. Next is clindamycin. So when we are administering the clindamycin to the patients, there is a chance of developing Stevenson-Johnson syndrome. So Stevenson-Johnson syndrome is occurred due to the administration of clindamycin. So it is also a type of antibiotic. In some cases, there is a trigger of Stevenson-Johnson syndrome. It is a serious condition affecting the skin and mucous membrane. So in this image, it is clearly we can witness that there is a development of skin and mucous membrane disorder while administering the clindamycin. That syndrome is known as Stevenson-Johnson syndrome. Next is corticosteroid. So when we are administering corticosteroid, if we are administering in a high dosage or for a very long period of time, there is a chance of developing a syndrome known as Cushing syndrome. So it occurs when a prolonged exposure to high dose of glucocorticoid medications like prednisone leads to abnormally high cortisol levels. So that condition is known as Cushing syndrome. This occurs due to the administration of corticosteroid. So whatever the syndrome we are seeing, no, it is not that everyone will have this syndrome. So some cases there is a chance of developing this signs and symptoms. So next we will see about the drug is phenytoin. So when we are administering the phenytoin, there is a chance of developing purple glove syndrome. So what is mean by purple glove syndrome? Is a rare but a serious complication, is a poorly understood adverse drug reaction typically associated with intravenous phenytoin administration. So here it is characterized by pain, edema and purple blue discoloration of the skin, especially leading to the tissue damage. So they will have a pain, edema and purple blue discoloration of the skin. So that's why when we are administering phenytoin, there is a chance of developing purple glove syndrome. So next is vancomycin. If we are administering vancomycin, there is a chance of developing red man syndrome. So what is mean by red man syndrome when we are administering vancomycin is, it is also known as vancomycin flushing syndrome. It is a common adverse reaction to an intravenous vancomycin caused by rapid infusion. So it is resulting in histamine release and characterized by rash, flushing and potentially other symptoms. So this is known as vancomycin. They will develop a reddish discoloration, that is flushing characteristics in the skin all over the body. So next drug we are going to see is warfarin. So when we are administering the warfarin, there is a chance of developing the condition known as purple toe syndrome. So what is mean by purple toe syndrome? It is a rare complication characterized by the sudden appearance of painful purple discoloration in one or more toes. So often associated with warfarin therapy, and it is due to the reduced blood flow or the circulation. So next, the last one is phototherapy. So when we are giving phototherapy to the babies or the newborns, there is a chance of developing the condition. Can you guess it? Yes, you are absolutely right. The condition is bronze baby syndrome. So when we are giving phototherapy for the neonatal jaundice, there is a chance of developing bronze baby syndrome. It is also a very rare complication only. So this causes the bronze discoloration of the skin due to the accumulation of bilirubin photoisomers and other metabolites. So the baby will be looking like a bronze yellowish color of their bodies. So that is known as bronze baby syndrome. Okay, the video is over. Shall we have a recapitulation session? So recapitulation is just having a small gist of what we have seen. If you know the answer, just comment in the comment box. We will see who all got the right answer. So the syndrome, when we administer chloramphenicol, what syndrome the patient will have? Do you have any idea for that? Yes, you are absolutely correct. The syndrome is grey baby syndrome. So when we administer chloramphenicol, there is a chance of developing grey baby syndrome. Next is vancomycin. So what is a syndrome for vancomycin if you are administering? Yes, you are absolutely correct. It is a red man syndrome. So next drug is aspirin. So when we administer aspirin, what is a syndrome is known as? Reye syndrome. So you are absolutely correct. You have got the full mark. So if you find this video to be useful, kindly like it, share it and subscribe it, and share among your friends. Thank you for watching.